Good morning, everybody. Happy Friday, and we are back at Natural Transplants Bethesda office. We got Hasim today. Welcome, man.
How you doing, Dr. Kev?
Good to see you, man. Thank you for doing this. This is awesome. Hopefully this helps people out. Let everybody know what brings you to us, what we're doing today, and how you found us.
Well, I came here because I'm obviously suffering for hair loss, and I'm just trying to recreate my hairline because I've been losing it, the past few years.
Yeah.
And
you're young, man. You're 20.
I just turned 31.
31, yeah.
I look
you're young.
You're
young.
I get it.
All right.
But I heard about you guys through searching on Google.
Okay.
I like the results.
Yeah.
I looked through all the videos and
Awesome.
it caught my eye. So
Awesome.
that's why I decided to reach out to you guys and do this.
Love it, man. Well, again, appreciate you doing this thing. So I'm gonna have Saul zoom in here. Obviously, duck your head just a touch. And obviously, you got some pretty significant loss all the way back. So today we're really gonna be focusing on kind of that front third, front half. So we're gonna start from the hairline, go back, kind of as far as we can go, but it'll probably be around that front third, halfway mark. We got some dreads in the back, so we're gonna be working through that. And what we'll do, we'll draw it all out, and then we'll come check in a few minutes. Does that sound good?
Yes, sir.
Cool. Awesome, man. Thanks. All right, we are back with Hasim, and we have drawn out a nice straight line. We talked about doing the temples, although it's not his priority, so we're going to hold off and just go further back, and that'll give us more hair to work with. So I'm going to have it look down a little bit. And like I said, we're probably going to get somewhere around here. If we have more, we'll just keep marching back as far as we can go. How you feeling?
I'm feeling good.
You ready?
Yeah, I'm ready.
Got a couple Valium on board, ready to rock and roll.
Yes,
All right, we'll check on you a little later, okay? Awesome. All right, we are back. Hasim, congrats, man. You did it.
Yes,
How was
sir.
today? Be honest with everybody. How'd it go?
It went good. The procedure, like the initial part, was the most painful when it was like stabbing.
The shots, yeah.
Yeah, like doing that part hurt the most.
Yeah.
But other than that, it was cool. It was
You
smooth.
powered through, man. You didn't scream or yell or anything. It was good.
Yeah.
That was awesome, man. We had some lunch, watched a couple movies. I love what we did. We got about a third, maybe a little bit more than a third of the way back. So of Ron come in, but we really packed it in nicely. I love it, man. We saved as much of the dreads as we could. So from here on out, we just kind of watch you. All right, come back in a year, and we'll hopefully you'll have a big mound of hair on the top, and we have a big party. All right.
Okay.
Thank you so much for doing this. Welcome to the family, and hopefully we can kind of follow you along. Sound good?
Yes, sir.
Cool,
Thanks
man.
for having
Thanks.
me, guys.